Hello everyone. Hi, I'm Jewel. Welcome to my channel. Today's topic is going to be children with kidney disease. This article comes from the National Kidney Foundation, and I must say when I read the article I was very moved by it. It's probably going to be two videos, guys, so let's get started. Living with kidney disease as an adult is very difficult, but living with kidney disease as a child is almost unbearable, according to Sarah Finlayson, 51, who was just 21 months old when her kidneys failed. She says, I was sick and I didn't know why. My parents never talked about it at home. I didn't know about diet and nutrition. I was living in the dark. And I was bullied a lot in school, especially when I was sick. It was a different experience than being an adult kidney patient. Almost 10,000 children and adolescents in the U.S. are living with end-stage renal disease, which is ESRD. They are 30 times more likely to die than healthy children. Young adults with ESRD since childhood have the life expectancy of 38 years if they are treated with dialysis, and 63 years if they receive a kidney transplant. Many more have conditions that dramatically increase their risk of kidney disease and kidney failure. 1 in 10 youths in the U.S. has hypertension. 2 in 10 adolescents, average age 11, are obese. The National Kidney Foundation wants to do something about these alarming statistics. At the first ever National Kidney Foundation scientific workshop on CKD, which is chronic kidney disease in children, on December 6th and 7th in Atlanta, dozens of professionals in pediatric nephrology, patients and their parents will gather to use recent children-focused research, the needs inherent in stories like Sarah's, and new ideas from the meeting participants to make recommendations that will improve the care for kids with the overwhelming disease. With this conference, we are putting our stake in the ground to fight pediatric CKD, says National Kidney Foundation Chief Medical Officer Dr. Joseph Velasati, MD. No child should have to live with the burden of chronic kidney disease, but if they have to, they certainly should count on us to help them live as normal as a childhood as possible. Well-controlled kidney trials in children with CKD are scarce due to the small population and their exclusion from most therapeutic studies. Therefore, recommendations for clinical care in pediatric nephrology are most often based on small trials and expert opinion, with the latter commonly the product of little published evidence. The time is right to make every effort to enhance the care of children with CKD. The conference in Atlanta will be attended by top pediatric nephrologists and other kidney-related doctors, social workers, dietitians, nurses, parents, and patients, and it is by invitation only. They will meet for 2 days of lectures and breakout sessions. This conference is designed to bring together what we know, what we can do with what we know, and what we know and what we need to know regarding the unique challenges of caring for children with CKD, says Dr. Freer. Children with CKD often do not understand what the illness means and can become depressed as they try to sort through the demanding medical condition, especially if they think no one understands them. Guys, I'm going to stop it right here and continue on the next video talking about children with CKD. As you see, this is a big problem in the kidney community for children because there aren't a lot of studies done for their illnesses, and what the National Kidney Foundation wants to do is bring this problem to light for all of us, so that we may find ways to help children, the smallest of us that are living with the disease, to better their conditions and to have a better childhood, for themselves and their parents. So, guys, if you found this information useful, please like, share, and subscribe. And for all of us that had chronic kidney disease and we're on treatment, and for all of us in that has had transplants, we wish all the children and their parents so much love, and we're hoping that this conference will bring a better understanding and a better treatment for children that are suffering with this awful disease as children. So, guys, I will see you on the next video to pick up where I left off. Thank you, and see you in the next video. Bye.